A Michigan father sat in the parking lot of this hospital feeling like he had nowhere else to turn but to the internet. He made a video last month pleading for help for his son who needed mental health services. That video has since gone viral, and his son has been moved to an inpatient mental health clinic.
And I can't believe I'm going to sleep in there again in that lazy boy with my son who now has had no help at all. And he needs it.
Jay Gross and his wife Joanne have 3 boys that they have adopted.
And our boys, when we adopted, we were told that they come with baggage. They've been through a lot, and we understood that. And still, you fall in love with your kids. There's not much you can do. You just do what you do as a parent.
On February 14th, a situation happened with their 15-year-old son.
And it was just one of those things that just shocked us. We had found a couple of letters that were written, and we confronted him, and we talked to him. He admitted it, but it didn't go the way that we planned.
Prior to that, Gross says the school system had contacted them to let them know their son had been researching suicide on the internet.
So I called the family doctor, I called his counselor, and both, without ever talking, said, take him to Gratiot ER, get him admitted, we'll get him into an inpatient clinic. And that's kind of where the nightmare began.
That nightmare would be them spending 12 nights in the ER waiting for their son to get the help he needs. Because the entire state of Michigan has just 399 inpatient psychiatric beds for children and teens.
My wife, who's an absolute warrior, went up, down, left, and right, contacting herself along with the hospital, inpatient residentials, to see if there were any beds, and there were never any beds, or he was too acute for that, or we just couldn't fit him in.
Gross says the day he made the emotional video that has now seen more than 100,000 views on YouTube, he had fought for almost 5 hours trying to get digital signatures for a subsidy.
I shut my phone off for about 2 hours, took a nap with my son in the ER, and I woke up, turned my phone back on, and it was like, wow. 24 hours later, he's gone to an inpatient.
There's a terrible drought of inpatient psychiatric beds for adults and kids.
Bob Sheehan says a survey that their members have done says it takes about 9 calls for every 1 inpatient psychiatric admission. He also says the lack of access to inpatient psychiatric beds is about more than just numbers.
The first is there aren't enough beds, but actually more deeper than that, in fact, though, is the milieu, the mix. So if you're running a hospital ward that is set up for people who have little behavior problems, they might be depressed or anxious, you're not ready for someone with behavior problems.
He says it's hard to mix a person in who might have a violent streak in with a fragile patient population. He says that can be solved with the physical changes. But the bottom line is
Jay and his family should not have had to go on Facebook and plead for care. That's what's wrong with the system. The system is that there aren't enough hospital beds. We were part, as well as 51 other members, of trying to work to break that logjam. And it still isn't solved. I mean, obviously, Jay Gross helped us see that.
the Grosses say other parents have been contacting them after seeing their story. Although they don't know where their path is going to lead them, they say don't give up.
They're crying alone at night. They don't know what to do. Their child's violent. Their child's depressed. Their child's attempting suicide. Don't give up. There has got to be a way to get these kids a voice. There's got to be a way to make a change.
Reporting in Alma, I'm Tiana Jenkins.